Hi, good morning, everybody. I'm back again. In fact, today I'm going to continue my previous video. The previous video was talking about anxiety and pain, and I have divided that video into two parts because it was too long, and I felt that it will might overwhelm some of you with the information inside. I am in process now of getting these videos uploaded. I hope that you find these educational videos useful for all of you. You might ask yourself why I'm uploading and giving this message right now. Well, I do believe that in the pain clinic, usually there is no enough time to explain everything from many healthcare professionals. The pressure load is huge, and I do feel that the 45 minutes consultation or 30 minutes or 20 minutes or even 1 hour, sometimes it's not enough, in fact, to explain everything that we need to say. So I think these videos, now while everyone is locked in his house and has free time to listen or to learn more about the chronic pain and the complexity of the situation, might help him or her. So when you go to see your pain specialist, you will have already some information on and about what's going on. So last videos I spoke about the anxiety relation to chronic pain, and in fact what is the anxiety can do in the body and what stress can lead to in the body. I also spoke about the link between stress and the hormones and the neurotransmitters in the body, and what is this in relation to chronic pain. I didn't have enough time to speak about how we can deal with these problems, and I will actually give some, few topics about this issue. Of course, saying it, it's not easy to implement, but at least you will have some idea about what it is and what you should do. These questions are always going on and on and on in pain clinics, and it needs a lot of expertise and patience and time to explain what's going on really. So I'm hoping you can have some answers through these educational videos. Same time, if you have any query or comment, you can put it in the comment section, or if you want to contact me confidentially, you can reach me through my website, which is www.paintreatment.co.uk. Uh, you can email me and I will be happy to assist you. Also, if you need to hear about some topics or you have some questions you want to hear in the coming educational videos, you can highlight this to me and I'll be very happy to explain this in future. So, what we can do about anxiety? It's a great topic and very difficult time for everyone now, especially in the presence of the current pandemic in the world. Anxiety can be, you know, triggered by certain factors. One of them is chronic pain. One of them is the current situation, but also it can be, treated or at least managed by other factors. One of them is breathing exercises. Breathing exercises is very, very useful. So, if you don't have an access to a specialist who can help you, you can find a lot in the YouTube and in the media about how to do relaxing uh, breathing exercises. Also, yoga in my view is very good. There is normal yoga and there is a hot yoga which I haven't tried, but I heard it's very good. So this is one form of relaxation indeed. Also, there is a nutrition. Nutrition, of course, is very, very important. Why? Because the type of food you eat actually can affect your status generally and on the mental health level as well. As you know, there is probiotic, there is prebiotic, there is a lot of talk about this. So speaking about this with your dietitian will be very useful. But what is the science behind nutrition? Of course, the topic is so big and I cannot cover all of it, but I can give you one hint or a couple of hints about it. There are natural supplements, and these supplements, there is some evidence behind them. There are a lot of publications in the literature speaking about what is the nutrition and what is good and what is bad. The evidence is conflicting, but I am aware and sure that some of them have good evidence behind. One of them actually is the curcumin, and curcumin is actually proven in a study in 2015 to be helping in the cognitive and behavioral disorders. One of them is anxiety. Also, turmeric and curcumin actually has been shown to be good in treatment of arthritis. So these natural supplements can be found in your normal diet, or in the food, or in the health shops. So there are lots and lots, but I believe that good nutrition can participate in the healthy minds, healthy nervous system, healthy body, and eventually on chronic pain status. So at this stage, I need actually to give you a small definition about chronic pain because I haven't had a chance to explain this to you. What is chronic pain? Chronic pain is an unpleasant sensation. The unpleasant sensation is the chronic pain. Whatever is this sensation, but it is unpleasant. Chronic pain is the pain that persists for more than 3 months, whether intermittent or on a constant pattern. So this is a chronic pain. It is really big and magnificent problem around the world. So what we can do about chronic pain? That is the answer. That's the question that has no answer so far. We can manage chronic pain. We can alleviate chronic pain. I cannot say we can cure chronic pain. It's a chronic illness. But to the best of my knowledge, some patients do have achieved excellent results when they have gone through the right pathway, when they have the right diagnosis, the right treatment, the right protocol, and I believe this is the key. I cannot say that all of you will be cured, but at least you will have anywhere between 30% or higher of relief when you see the pain expert. Of course, this is not actually to give you a pessimistic view or picture about chronic pain. No, not at all actually. I'm always very, very optimistic when I see my patients. I always give them the high spirit that they will be treated correctly. They will have the full information about what's going on. I try to give them the proper diagnosis, and also I give them an honest opinion whether each step